first question. Do I really have to get a mammogram every year? Can it go like 18 months, every other year?
The recommendation from the American Cancer Society is yearly, and particularly in younger patients, a lot can happen in a year. So yes, it is important that you come every year.
Do you find women have trouble fitting that in?
It is tough. Our offices do offer very early morning, evening, and weekend hours, and for the most part, people can get a screening mammogram in without too much trouble.
Okay, so tell me, does your risk for cancer, for breast cancer, change as you age?
So your risk for breast cancer increases the older you get, based solely on your age. By the time you get to about 85, the chances are 1 in 8 that you will have breast cancer.
Are recommendations for them to have more frequent mammograms?
No, it's still yearly. In fact, some of the colleges don't even recommend yearly after 75, which I think is a mistake. The thought being that the older you are, the less aggressive these cancers tend to be. But I've seen very aggressive cancers in older women, and I don't agree with that.
Yeah, interesting. Okay. And sometimes in a mammogram, they'll tell you you have dense breast tissue. What does that mean?
On mammograms, things are either black or white. Fatty tissue is blacker, and dense tissue is much, much whiter. Breast cancers show up on mammograms as white spots. So you can imagine that the more denser white tissue that you have on your mammogram, the harder it is for us to see the small white cancer developing. In addition, the dense tissue itself is an independent risk factor for breast cancer, meaning just because you have dense tissue, regardless of any other risk factors that you might have, it does increase your overall lifetime risk of getting breast cancer.
Wow. Okay, so if you're looking for a white cancer on white dense breast tissue, what do you do?
We do tomosynthesis images or 3D mammograms, which helps us see through that dense tissue a little bit. And that helps dramatically. The other thing that we do are what are called supplemental screenings. And in New Jersey, most insurance companies are required to pay for supplemental screening if you have dense tissue. And that usually in this area ends up being a screening breast ultrasound, which looks with ultrasound at all of the tissue in both breasts. And that's just another way we can sometimes find cancers that we don't see on mammograms because of the denser tissue.
Okay, so is that when you have a mammogram and they call you back? Is that what that is?
That's a little bit different. When you have a mammogram and we call you back, it's because there's something on your mammogram that looks a little different than it has in the past. It may mean that we're concerned there's a mass, there may be some calcifications there, but there's some change that concerns us a little bit. When we ask you to come back, you usually do get extra mammogram pictures, and you often do get an ultrasound at that time. That is a more focused ultrasound that just targets the area that looked a little suspicious on the mammogram. It's not an ultrasound that looks at all of the tissue in both breasts like a screening breast ultrasound.
Okay, great information. Thank you. And we will stick to 1 year for our mammograms. Thank you.
Good.